Good morning and welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. We'll begin today's show focused on breast cancer awareness. Rates of breast cancer among African American women in the U.S. are increasing. Nationally, only 68% of Black women diagnosed with breast cancer are alive 10 years post-diagnosis, as compared to 84% of white women. My first guests are here to discuss that reality and inform us about a new intervention that's being launched to bridge the gap called Sister Pact. Dr. Sandra Millen Underwood is a professor at the University of Wisconsin-Milwaukee College of Nursing, and Lisa Goodwin, she's a breast cancer survivor. Good morning, ladies.
Good morning.
Thank you both for being here, and I'm really excited to talk about this initiative that is really just getting underway. And so a lot of people are really just now becoming informed about Sister Pact. So hopefully after today's show, they'll know all about it and be on board to help make a difference. Dr. Underwood, a recent study by Dr. Kristen Beyer at the Medical College of Wisconsin identified some specific Milwaukee areas as hot spots where women are nearly twice as likely to die from breast cancer than women who are living in surrounding neighborhoods. So we need to talk about why that is. But first, if you would, tell us more about the Wisconsin Breast Cancer Task Force, this coalition that's working to improve breast cancer screening rates in Wisconsin.
Well, first and foremost, thank you so much for focusing attention on the issues surrounding African American women and breast cancer. The Wisconsin Breast Cancer Task Force has been involved for the last 10-some years in developing interventions and focused specifically on, breast cancer screening and early detection among women across the state. Here in southeastern Wisconsin, a number of institutions and organizations have gathered together to try to do more to reach women who are not adequately served within our area relative to screening and appropriate treatment. As you mentioned, we have some recent data that's identifying some very specific, targeted, and key areas within southeastern Wisconsin where there is increased incidence and also poorer survival. We find that this is the case primarily because women in certain communities do not have the information regarding the importance of screening and also are not taking advantage of the resources that are available and getting treatment if indeed they are indeed diagnosed with the breast cancer.
All right, and that's part of my job, is to make sure they know about those resources that are out there. And so these key areas that are being researched is 53205, 206, 208, 210, 213, 216, and 233. And you just mentioned why those particular zip codes are important, because many times they don't have the information that they need in order to take advantage of resources that are out there, et cetera, et cetera. So Lisa, as I mentioned, you are a breast cancer survivor. So if you would, tell us a little bit about your background and your journey as a survivor and your work with Sister Pact.
Okay, thank you. First of all, I'd like to say thank you for inviting me.
It's my pleasure.
You're welcome. I am a 5-year breast cancer survivor, Andrea. I am the 5th lady in my family to have had breast cancer, as well as the youngest lady. I was 38, I believe, when I was diagnosed. Just from early detection, I had been taking mammograms since I was 25, I believe, because my mom's had breast cancer. My aunt and a couple of other people in my family. I had a great cousin who passed away from not getting treatment. So just taking early detection helped save my life. Just taking mammograms is how I was even detected with breast cancer. The journey was long. I took treatment as far as chemotherapy. I did radiation. After that, I was only asked to do the chemo and radiation because of the family history. But now I am a spokesperson. I got to work with Sister Pact through the Susan G. Komen. They asked me to be a spokesperson because I also work with Dr. Alice Yan at UWM as a research consultant for breast cancer, and I teach focus groups and educate women and help them get sources and things like that to get early detection, or get mammograms, or get screening, or even link up with Dr. Underwood or in different other organizations.
Yeah, it's so important what she just said, because so many times you hear, get your mammogram once you turn 40, and she was diagnosed at, you said 38?
38, yes,
38. So knowing that if you have a family history of breast cancer, that you need to be screened earlier than 40 is also something that's very important. So that's the role that you're playing with Sister PAC, to help other women know these things just like the back of their hand, you know, when it comes to spreading the information and helping out their family and friends when it comes to better understanding this disease.
Yes, ma'am, and getting them hooked up, because there are so many people that are underinsured, or they don't know where to go, or they're just scared. That's the biggest thing. So, dealing with Dr. Underwood and other organizations, we get together, we encourage them to get mammograms. If they don't have insurance, we give them the resources and the places that will give them free screening or free tests. And there's even grants out here that will actually pay for insurance or pay for your treatment.
Okay.
For your mammograms, and for even if you're diagnosed. But the biggest thing that I would have to say is that knowing, getting together as a community, as a team, and things like that, that makes things much easier and less stressful on the ladies, as far as if they're scared of a mammogram, if they're scared of treatment, if they have no one to talk to or no one to network with. That's where we play a role.
Knowing that they're not in this alone. And if you have questions, somebody like Lisa's been through it, been there, done that, and is a beautiful picture of health today.
I am very fine.
Here to tell.
Yes.
Here to talk about it. That's very important. Then this task force is partnering with a biotech company to roll out a project. This project, Sister PAC, that we've mentioned, it was piloted in Memphis, Tennessee, which also has some very startling numbers when it comes to Black women dealing with breast cancer. And now it's being unveiled here in Milwaukee. Talk about how Sister PAC works, if you would, Dr. Underwood.
Well, Sister PAC, aims to increase the conversation among African American women within southeastern Wisconsin. As Lisa mentioned, all too often women in our community are not aware of risk factors. Many of them are not aware of their own family history. Many of them have not had conversations with their sisters, with their mothers, with their cousins, with their neighbors about the importance of breast health. So the Sister PAC initiative, aims to increase that conversation, but also to get the women together to promise among one another to take better care of their breast health, to work together to identify resources within our local community for those who are underserved, underinsured, uninsured, to access those resources. One of the other aspects of Sister PAC is for sisters to work together, to go together if need be, to get the screenings that are necessary and to follow up if there's a follow-up that's needed.
Okay, and Lisa, there's this awareness campaign that people are going to start seeing very soon, and you are a part of that.
I am a part of it. I am a part of it, Andrea, with my best friend for over 40 years.
Oh, that's wonderful.
We've been friends for ever. Her mom is my mom is her mom. Her mom passed of cancer. She just recently did a mammogram, but she is such a Regina. Her name is Regina. She's such an awesome person. When I was going through treatment, she doesn't drive because she has an eye disease. I said, well, my mom will pick you up. She caught the bus. She was there with me all the way through. She was there before I got to the hospital, and she's been there from day one.
Wow, and so that's what the Sister PAC is all about, and your Sister PAC has lasted ever. We take the 4 off, just ever. And the thing is, we talk about the resources and how important it is for people to know that certain things exist. So there is a web-based resource directory when dealing with Sister PAC, and also you guys are telling people to call 211. If you can't remember anything else, call 211 for information. So talk about the risk factors that people should keep in mind when it comes to breast cancer awareness.
Well, there are a number of risk factors that are associated with breast cancer, but the #1 risk factor that women need to be aware of is just being a woman. Breast cancer occurs more often among older women, but as you can tell, having spoken with Lisa, that many younger women also have been diagnosed and are being diagnosed with a breast cancer. Women who have a family history, first-degree family history of breast cancer, also at a slightly increased risk. But as I mentioned, the #1 risk factor is just being a woman. So all women need to be concerned. Even if you don't have any risk factors, all women need to be concerned about the importance of early detection and screening.
Okay, and something else we should mention, obesity is a risk factor, and race and ethnicity is something people need to keep in mind as well.
Yes,
Yes.
yes, absolutely.
Something else, menopause after the age of 55. So we talk about things that people go through as women, and that's just something people should have in the back of their mind as well, that they could be at risk if that is a factor.
More or less. Early menstruation and late menopause also does slightly increase one's risk of breast cancer, as does very dense breasts as well.
Okay. I definitely wanted to mention Sister Pack is the title sponsor of Jammin' 98.3's Women's Expo, which is coming up on Saturday, March 11th. It's titled The Gathering, and I work at Jammin' 98.3, of course, so I have to mention it. 10 a.m. to 3 p.m. Potawatomi Hotel Casino's Expo Center, and this is going to be an opportunity for all the women who join us on that day to really have a better understanding of Sister Pack and to really take, I would like to say, an oath or make that commitment to really help spread the word and educate each other about the importance of breast cancer awareness, because we all know that early detection is the key to surviving this disease.
Absolutely.
Yes. Is there anything else that you all wanted to share with us today in dealing with Sister Pack and all of the outstanding things that are taking place here in the city of Milwaukee now?
You know, as you mentioned, there will be, a major event at the Gathering for Sister Pack, but there also will be another event on that very same day at the very same time that's sponsored by V100.7. The Family Affair will also have another opening and launching of the Sister Pack at that particular event as well.
Okay.
There'll be a number of activities that will be going on around the cities over the next several months. So you can see us, look forward to seeing more about Sister Pack, within the community.
Yes, and Lisa, your face is going to be on some things, right?
Oh, yes.
Yeah.
My face will be on they said the web, the bus stops, the bus booths, anywhere they choose to use them. Regina and myself.
That's
we
wonderful.
will be, and we will be at the Gathering with you. I advocate on spreading the word.
Okay.
So we will be there. We were invited.
Looking forward to it, ladies. And I thank you so much for coming by and just making everybody aware. They're going to be seeing more things dealing with Sister Pack, and they're going to be hearing more.
Absolutely.
And this gives them an opportunity to kind of have a better understanding right out the gate.
Absolutely.
So thank you both for coming by today, and we'll see you soon.
Absolutely.
Right. Thank you for
Dr.
having me.
Sandra Millen Underwood, she's a professor at the University of Wisconsin-Milwaukee College of Nursing, and Lisa Goodwin, she is a breast cancer survivor and spokesperson for Sister Pack. For more information, you can visit sisterpack.com or call 844-SIS PACT. We encourage women to become more informed so that they are not only aware but truly understand the ramifications of breast cancer. Make a commitment, a Sister Pack, and take action. When we return to Our Issues Milwaukee, we'll switch gears and meet a young man who grew up in Milwaukee and has gone on to do great things in Hollywood. We'll meet Brendan Carter and find out how he plans to make Milwaukee proud on film. We'll return to Our Issues Milwaukee right after this.